Dear Chair, dear audience, I'm here to present my PhD thesis, which has the title of The Link Between Cognitive Training and Neuroplasticity and Mild Cognitive Impairment. I am Eszter Radics, and I'm a cognitive neuroscientist, currently doing a full-time PhD at the János Szent Ágotay Doctoral School of Neuroscience. My supervisor is András Attila Horváth, my SMS is Marie, and my statistician helping me is Silvia Kisdala. My vision is that all preventable dementia cases are prevented, and my mission is to evaluate cognitive trainings to delay or prevent dementia. So in order to achieve these goals, we specified 2 goals: investigating the effectiveness of cognitive training in adults, that would be a systematic review and a meta-analysis, and the second one is advancing initiatives of dementia risk reduction, which will be a survey. So about the first project, as you all know, dementia is on the rise and it will affect 139 million people by 2050. There is no cure yet, but different lifestyle interventions show promising results. A recent study showed that at least 40% of all dementia cases are linked to modifiable lifestyle and environmental factors. A wide range of cognitive trainings exist, but their exact effect is still unknown. So it raises the clinical question of how does cognitive training influence structural and functional network connectivity and metabolic changes in the brain. We use the PICO framework. Our population is adults. We are planning on doing a lot of subgroups of the population. The interventions are designed and validated cognitive trainings, and the comparator is no cognitive training. The outcomes are objective biomarkers of cognitive risk. Our hypothesis is that cognitive trainings have a beneficial effect on the brain compared to no intervention. Here you can see my search key. We conducted the search in 3 databases in November last year. Here's the flowchart of selection. We had like 6,000 hits, and I'm still doing the full text selection, so I cannot exactly say how many there will be. Yes. So the ongoing analysis, there's still a lot. You can see the subgroups there, the population, and we have a lot of outcomes as well. So each population has all of the outcomes, so a lot is still going on. And the finished analysis is the healthy population, structural MRI, and diffusion tensor imaging. So this first plot shows the DTI, the structural connectivity measured by fractional anisotropy. Fractional anisotropy gives a number between 0 and 1, 1 meaning better white matter integrity. Here you can see the heterogeneity is 76%, but has a really big confidence interval. This could be because of the different, the cognitive trainings target different functions in the brain, and also the length of the cognitive trainings were different, and the follow-up times were also different. And you can see that outlier, the cow study, they used a 1-year follow-up, while the other studies used a 3-month follow-up time. So this suggests that cognitive trainings are beneficial in the long term, not in the short term. The next plot is the subgroup analysis for left and right hippocampal volumes. This is also for a healthy population, and the heterogeneity is 0%, but also with a very wide confidence interval. It is basically the same reasons as the previous plot. Here you can see that the pooled effect size for the left hippocampus is 35, which we consider clinically significant, because as you can see in the no cognitive training group, there was a shrinkage of the hippocampus, which is a normal thing during, with time, hippocampus shrinks usually. And in the cognitive training group, there was a positive change in the volumes. Yes. This asymmetry, also I haven't shown in the groups, but we've seen that the left hippocampus was smaller before and after the intervention than the right. And this could be because gray matter atrophy seems to occur earlier and progress faster in the left hemisphere. Also, left hippocampal gray matter volume significantly correlates with performance in memory tasks, and it's associated with episodic verbal memory, whereas right spatial memory and the left hippocampus is more affected by Alzheimer's disease, which is really important to us. So the strength of this paper is that we are looking at a wide range of neurological conditions. There's no previous meta-analysis on objective parameters of cognitive trainings, and we have a lot of outcomes. The limitations is the heterogeneity in the intervention and the population, and currently only baseline and after values are pooled, and we have big baseline differences in the groups, which is not good. So we don't have the implication for clinics yet, but for research, standardizing cognitive training's length, better randomization, ensuring no baseline differences, standardizing data reporting and reporting all the data, and further investigation on the effect of the left hippocampus would be beneficial. And I would like to change to my second project, which is advancing initiatives of dementia risk reduction. As I mentioned, this will be a survey. And about the background, behavior change interventions are poorly understood and not developed systematically. Compliance is dependent on how well people involved in dementia care work together, and personalized medicine could lead to improved quality of life and health disease-related behavior. Our clinical question is, what are the components of priority of prevention for patients, clinicians, and caretakers? The population would be everyone involved in dementia care. The factors are social factors of importance, and the context is primary, secondary, and tertiary prevention. The clinical and the research implication of this project would be designing better interventions and communication strategies tailored to patient and caregiver priorities, and improving adherence and compliance. Well, the methods, we are working on surveys. We are planning to organize a focus group based on the European Working Group of People with Dementia. We are planning to include healthcare professionals, patients, as well as informal caregivers. And yes, we will be using this kind of surveys that was used before in other papers. So to summarize, I have these two projects. I'm planning to finish by June and by next year, March. And I would like to thank your attention with this quote of Aldous Huxley. Systematic reasoning is something we could not, as a species or as individuals, possibly do without. But neither, if we are to remain sane, can we possibly do without direct perception. The more unsystematic, the better, of the inner and outer world into which we have been born. Thank you.
I would actually immediately have a question. So you mentioned that your forest plot is clinically significant, yes, but it did not look mathematically significant. I noticed that you have very wide confidence intervals. Why
Yes.
might that be?
Well, oh no, sorry, it's this one. Well, okay, so here we had calculated the standard deviations from the pre and the post hippocampal volume standard deviations. That's why it gives this wide confidence intervals, and we are planning on contacting the authors to get the missing data and to reduce these confidence intervals, and maybe that would lead to a mathematically significant result. But, yes.
Thank you.
Okay, thank you for the nice presentation. I won't be polite. Were you able to conclude anything from the meta-analysis if these data are so different, and especially on the cognitive training, if it is useful, or there were so many methodologies that you have to plan a new training method? So what is your opinion on that?
Well, I mean, that's the whole point, that there's a lot of cognitive trainings and we don't really know what is going on. So that's why we do a meta-analysis, that even if they are so heterogeneous, we just need to know if they are effective or not in any way.
You may know the best.
Yes, exactly.
And what about the physical training on cognitive function? Do you have any data on that?
No, because we excluded everything about physics, because yes, that's also effective, but it's a very different topic, I think, so we excluded, and also there's meta-analysis in that, recent meta-analysis, so that concludes all that you need to know. Yes, thank you.
I have also a methodological question to you, because as we discussed, there are many risk factors for dementia. And if you would like to examine the effect of cognitive training, how could you eliminate the effect of this influencing, confounding factors for the first? And for the second, when you talk about cognitive training, the length of the cognitive training, frequency of cognitive training, which domain of the cognition is trained, have you examined this?
Yes, but the thing is that if we are, okay, so the data is really heterogeneous, but we have to pull them somehow, so we are trying to make them work. I mean, how to say? We could not do a meta-analysis if everything has to match, because there's no enough papers and no enough data for that. So in order to achieve a meta-analysis, then we need to make some changes that I don't know how to say.
Just a follow-up question to that. Are you planning any kind of sensitivity analysis based on these factors?
Yes.
Good.
We are planning. Thank you.